Hey Alpha Nurses, I'm Licensure from alphanursguide.com. This is 80 practice questions. Without delay, let's get started.
A client with a large goiter is scheduled for a subtotal thyroidectomy to treat thyrotoxicosis. Saturated solution of potassium iodide is prescribed preoperatively for the client. The expected outcome of using this drug is that it helps 1. Slow progression of exophthalmos. 2. Reduce the vascularity of the thyroid gland. 3. Decrease the body's ability to store thyroxine. 4. Increase the body's ability to excrete thyroxine. The correct answer is 2. Reduce the vascularity of the thyroid gland. SSKI is frequently administered before a thyroidectomy because it helps decrease the vascularity of the thyroid gland. A highly vascular thyroid gland is very friable, a condition that presents a hazard during surgery. Preparation of the client for surgery includes depleting the gland of thyroid hormone and decreasing vascularity. SSKI does not decrease the progression of exophthalmos, and it does not decrease the body's ability to store thyroxine or increase the body's ability to excrete thyroxine. The nurse is completing a health assessment of a 42-year-old female with suspected Graves' disease. The nurse should assess this client for 1. Anorexia. 2. Tachycardia. 3. Weight gain. 4. Cold skin. The correct answer is 2. Tachycardia. Graves' disease, the most common type of thyrotoxicosis, is a state of hypermetabolism. The increased metabolic rate generates heat and produces tachycardia and fine muscle tremors. Anorexia is associated with hypothyroidism. Loss of weight, despite a good appetite and adequate caloric intake, is a common feature of hyperthyroidism. Cold skin is associated with hypothyroidism. When discussing recent onset of feelings of sadness and depression in a client with hypothyroidism, the nurse should inform the client that these feelings are 1. The effects of thyroid hormone replacement therapy will diminish over time. 2. Related to thyroid hormone replacement therapy and will not diminish over time. 3. A normal part of having a chronic illness. 4. Most likely related to low thyroid hormone levels and will improve with treatment. The correct answer is 4. Most likely related to low thyroid hormone levels and will improve with treatment. Hypothyroidism may contribute to sadness and depression. It is good practice for clients with newly diagnosed depression to be monitored for hypothyroidism by checking serum thyroid hormone and thyroid-stimulating hormone levels. This client needs to know that these feelings may be related to her low thyroid hormone levels and may improve with treatment. Replacement therapy does not cause depression. Depression may accompany chronic illness, but it is not normal. When conducting a health history with a female client with thyrotoxicosis, the nurse should ask about which of the following changes in the menstrual cycle. 1. Dysmenorrhea. 2. Metrorrhagia. 3. Oligomenorrhea. 4. Menorrhagia. The correct answer is 3. Oligomenorrhea. A change in the menstrual interval, diminished menstrual flow, oligomenorrhea, or even the absence of menstruation, amenorrhea, may result from the hormonal imbalances of thyrotoxicosis. Oligomenorrhea in women and decreased libido and impotence in men are common features of thyrotoxicosis. Dysmenorrhea is painful menstruation. Metrorrhagia, blood loss between menstrual periods, is a symptom of hypothyroidism. Menorrhagia, excessive bleeding during menstrual periods, is a symptom of hypothyroidism. The nurse is administering a saturated solution of potassium iodide. The nurse should 1. Pour the solution over ice chips. 2. Mix the solution with an antacid. 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. 4. Disguise the solution in a pureed fruit or vegetable. The correct answer is 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. SSKI should be diluted well in milk, water, juice, or a carbonated beverage before administration to help disguise the strong, bitter taste. Also, this drug is irritating to the mucosa if taken undiluted. The client should sip the diluted preparation through a drinking straw to help prevent staining of the teeth. pouring the solution over ice chips will not sufficiently dilute the SSKI or cover the taste. Antacids are not used to dilute or cover the taste of SSKI. Mixing in a puree would put the SSKI in contact with the teeth. The nurse is teaching a diabetic client using an empowerment approach. The nurse should initiate teaching by asking which of the following? 1. How much does your family need to be involved in learning about your condition? 2. What is required for your family to manage your symptoms? 3. What activities are most important for you to be able to maintain control of your diabetes? 4. What do you know about your medications and condition? The correct answer is 3. What activities are most important for you to be able to maintain control of your diabetes? Empowerment is an approach to clinical practice that emphasizes helping people discover and use their innate abilities to gain mastery over their own condition. Empowerment means that individuals with a health problem have the tools, such as knowledge, control, resources, and experience, to implement and evaluate their self-management practices. Involvement of others, such as asking the client about family involvement, implies that the others will provide the direct care needed rather than the client. Asking the client what the client needs to know implies that the nurse will be the one to provide the information. Telling the client what is required does not provide the client with options or lead to empowerment. A 34-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? Select all that apply. 1. Rapid pulse. 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 4. Fine, thin hair with hair loss. 5. Constipation. 6. Menorrhagia. The correct answers are 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 5. Constipation. And 6. Menorrhagia. Clients with hypothyroidism exhibit symptoms indicating a lack of thyroid hormone. Bradycardia, decreased energy and lethargy, memory problems, weight gain, coarse hair, constipation, and menorrhagia are common signs and symptoms of hypothyroidism. Following a subtotal thyroidectomy, the nurse asks the client to speak immediately upon regaining consciousness. The nurse does this to monitor for signs of which of the following? 1. Internal hemorrhage. 2. Decreasing level of consciousness. 3. Laryngeal nerve damage. 4. Upper airway obstruction. The correct answer is 3. Laryngeal nerve damage. Laryngeal nerve damage is a potential complication of thyroid surgery because of the proximity of the thyroid gland to the recurrent laryngeal nerve. Asking the client to speak helps assess for signs of laryngeal nerve damage. Persistent or worsening hoarseness and weak voice are signs of laryngeal nerve damage and should be reported to the physician immediately. Internal hemorrhage is detected by changes in vital signs. The client's level of consciousness can be partially assessed by asking her to speak, but that is not the primary reason for doing so in this situation. Upper airway obstruction is detected by color and respiratory rate and pattern. Propylthuracil is prescribed for a client with Graves' disease. The nurse should teach the client to immediately report which of the following? 1. Sore throat. 2. Painful excessive menstruation. 3. Constipation. 4. Increased urine output. The correct answer is 1. Sore throat. The most serious adverse effects of PTU are leukopenia and agranulocytosis, which usually occur within the first 3 months of treatment. The client should be taught to promptly report to the healthcare provider signs and symptoms of infection, such as a sore throat and fever. Clients having a sore throat and fever should have an immediate white blood cell count and differential performed, and the drug must be withheld until the results are obtained. Painful menstruation, constipation, and increased urine output are not associated with PTU therapy. A client who has undergone a subtotal thyroidectomy is subject to complications in the first 48 hours after surgery. The nurse should obtain and keep at the bedside equipment to 1. Begin total parenteral nutrition. 2. Start a cut-down infusion. 3. Administer tube feedings. 4. Perform a tracheotomy. The correct answer is 4. Perform a tracheotomy. Equipment for an emergency tracheotomy should be kept in the room in case tracheal edema and airway occlusion occur. Laryngeal nerve damage can result in vocal cord spasm and respiratory obstruction. A tracheostomy set, oxygen and suction equipment, and a suture removal set for respiratory distress from hemorrhage make up the emergency equipment that should be readily available. Total parenteral nutrition is not anticipated for the client undergoing thyroidectomy. Intravenous infusion via a cut-down is not an expected possible treatment after thyroidectomy. Tube feedings are not anticipated emergency care. A client with thyrotoxicosis says to the nurse, "I am so irritable. I am having problems at work because I lose my temper very easily." Which of the following responses by the nurse would give the client the most accurate explanation of her behavior? 1. Your behavior is caused by temporary confusion brought on by your illness. 2. Your behavior is caused by the excess thyroid hormone in your system. 3. Your behavior is caused by your worrying about the seriousness of your illness. 4. Your behavior is caused by the stress of trying to manage a career and cope with illness. The correct answer is 2. Your behavior is caused by the excess thyroid hormone in your system. A typical sign of thyrotoxicosis is irritability caused by the high levels of circulating thyroid hormones in the body. This symptom decreases as the client responds to therapy. Thyrotoxicosis does not cause confusion. The client may be worried about her illness, and stress may influence her mood. However, irritability is a common symptom of thyrotoxicosis, and the client should be informed of that fact rather than blamed. One day following a subtotal thyroidectomy, a client begins to have tingling in the fingers and toes. The nurse should first 1. Encourage the client to flex and extend their fingers and toes. 2. Notify the physician. 3. Assess the client for thrombophlebitis. 4. Ask the client to speak. The correct answer is 2. Notify the physician. Tetany may occur after thyroidectomy if the parathyroid glands are accidentally injured or removed during surgery. This would cause a disturbance in serum calcium levels. An early sign of tetany is numbness and tingling of the fingers or toes and in the circumferal region. Tetany may occur from 1 to 7 days post-operatively. Late signs and symptoms of tetany include seizures, contraction of the glottis, and respiratory obstruction. The nurse should notify the physician. Exercising the joints in the fingers and toes will not relieve the tetany. The client is not exhibiting signs of thrombophlebitis. There is no indication of nerve damage that would cause the client not to be able to speak. The nurse is evaluating a client with hyperthyroidism who is taking propylthuracil 100 mg per day in 3 divided doses for maintenance therapy. Which of the following statements from the client indicates the desired outcome of the drug? 1. I have excess energy throughout the day. 2. I am able to sleep and rest at night. 3. I have lost weight since taking this medication. 4. I do perspire throughout the entire day. The correct answer is 2. I am able to sleep and rest at night. PTU is a prototype of thioamide antithyroid drugs. It inhibits production of thyroid hormones and peripheral conversion of T4 to the more active T3. A client taking this antithyroid drug should be able to sleep and rest well at night since the level of thyroid hormones is reduced in the blood. Excess energy throughout the day, loss of weight, and perspiring through the day are symptoms of hyperthyroidism, indicating the drug has not produced its outcome. Which of the following medications should be available to provide emergency treatment if a client develops tetany after a subtotal thyroidectomy? 1. Sodium phosphate. 2. Calcium gluconate. 3. Ecothiopate iodide. 4. Sodium bicarbonate. The correct answer is 2. Calcium gluconate. The client with tetany is suffering from hypocalcemia, which is treated by administering an IV preparation of calcium, such as calcium gluconate or calcium chloride. Oral calcium is then necessary until normal parathyroid function returns. Sodium phosphate is a laxative. Ecothiopate iodide is an eye preparation used as a miotic for an anti-glaucoma effect. Sodium bicarbonate is a potent systemic antacid. The nurse should teach the client with Graves' disease to prevent corneal irritation from mild exophthalmos by 1. Massaging the eyes at regular intervals. 2. Instilling an ophthalmic anesthetic as prescribed. 3. Wearing dark-colored glasses. 4. Covering both eyes with moistened gauze pads. The correct answer is 3. Wearing dark-colored glasses. Treatment of mild ophthalmopathy that may accompany thyrotoxicosis includes measures such as wearing sunglasses to protect the eyes from corneal irritation. Treatment of ophthalmopathy should be performed in consultation with an ophthalmologist. Massaging the eyes will not help to protect the cornea. An ophthalmic anesthetic is used to examine and possibly treat a painful eye, not protect the cornea. Covering the eyes with moist gauze pads is not a satisfactory nursing measure to protect the eyes of a client with exophthalmos because treatment is not focused on moisture to the eye, but rather on protecting the cornea and optic nerve. In exophthalmos, the retrobulbar connective tissues and extraocular muscle volume are expanded because of fluid retention. The pressure is also increased. A 60-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? 1. Tachycardia. 2. Weight gain. 3. Diarrhea. 4. Nausea. The correct answer is 2. Weight gain. Typical signs and symptoms of hypothyroidism include weight gain, fatigue, decreased energy, apathy, brittle nails, dry skin, cold intolerance, hair loss, constipation, and numbness, and tingling in the fingers. Tachycardia is a sign of hyperthyroidism, not hypothyroidism. Diarrhea and nausea are not symptoms of hypothyroidism. A client with Graves' disease is treated with radioactive iodine in the form of sodium iodide, I-131. Which of the following statements by the nurse will explain to the client how the drug works? 1. The RAI stabilizes the thyroid hormone levels before a thyroidectomy. 2. The RAI reduces uptake of thyroxine and thereby improves your condition. 3. The RAI lowers the levels of thyroid hormones by slowing your body's production of them. 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. The correct answer is 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. Sodium iodide, I-131, destroys the thyroid follicular cells, and thyroid hormones are no longer produced. RAI is commonly recommended for clients with Graves' disease, especially the elderly. The treatment results in a medical thyroidectomy. RAI is given in lieu of surgery, not before surgery. RAI does not reduce uptake of thyroxine. The outcome of giving RAI is the destruction of the thyroid follicular cells. It is possible to slow the production of thyroid hormones with RAI. The nurse should assess a client with hypothyroidism for which of the following? 1. Corneal abrasion due to inability to close the eyelids. 2. Weight loss due to hypermetabolism. 3. Fluid loss due to diarrhea. 4. Decreased activity due to fatigue. The correct answer is 4. Decreased activity due to fatigue. A major problem for people with hypothyroidism is fatigue. Other signs and symptoms include lethargy, personality changes, generalized edema, impaired memory, slowed speech, cold intolerance, dry skin, muscle weakness, constipation, weight gain, and hair loss. Incomplete closure of the eyelids, hypermetabolism, and diarrhea are associated with hyperthyroidism. After treatment with radioactive iodine in the form of sodium iodide, I-131, the nurse teaches the client to 1. Monitor for signs and symptoms of hyperthyroidism. 2. Rest for 1 week to prevent complications of the medication. 3. Take thyroxine replacement for the remainder of the client's life. 4. Assess for hypertension and tachycardia resulting from altered thyroid activity. The correct answer is 3. Take thyroxine replacement for the remainder of the client's life. The client needs to be educated about the need for lifelong thyroid hormone replacement. Permanent hypothyroidism is the major complication of RAI I-131 treatment. Lifelong medical follow-up and thyroid replacement are warranted. The client needs to monitor for signs and symptoms of hypothyroidism, not hyperthyroidism. Resting for 1 week is not necessary. Hypertension and tachycardia are signs of hyperthyroidism, not hypothyroidism. The nurse is instructing the client with hypothyroidism who takes levothyroxine 100 micrograms, digoxin, and simvastatin. Teaching regarding medications is effective if the client will take 1. Synthroid with breakfast and the other medications after breakfast. 2. Synthroid before breakfast and the other medications 4 hours later. 3. All medications together 1 hour after eating breakfast. 4. All medications before going to bed. The correct answer is 2. Synthroid before breakfast and the other medications 4 hours later. Synthroid must be given at the same time each day on an empty stomach, preferably 30 minutes to 1 hour before breakfast. Other medications may impair the action of levothyroxine absorption. The client should separate doses of other medications by 4 to 5 hours. When teaching the client to care for an ileal conduit, the nurse instructs the client to empty the appliance frequently. Which of the following indicates that the client is following instructions? 1. The skin around the stoma is red. 2. The urine is deep yellow. 3. There is no odor present. 4. The seal around the stoma is intact. The correct answer is 4. The seal around the stoma is intact. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Thus, if the seal is intact, the client is emptying the appliance regularly. The skin around the seal should not be red or irritated, which could indicate a leak. There will likely be an odor from the urine. Deep yellow urine indicates that the client should be increasing fluid intake. A client has undergone a cystectomy and an ileal conduit diversion. What should the nurse incorporate into the discharge instructions? Select all that apply. 1. Drink at least 3,000 milliliters of fluid each day. 2. Minimize daily activities. 3. Keep urine alkaline to prevent urinary tract infections. 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. 5. Wear snug clothing over the stoma to encourage urine flow into the drainage bag. The correct answers are 1. Drink at least 3,000 milliliters of fluid each day, and 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. An adequate fluid intake aids in the prevention of urinary calculi and infection. Odor-producing foods can produce offensive odors that may impact the client's lifestyle and relationships. Lack of activity leads to urinary stasis, which promotes urinary calculi development and infection. Acidic urine helps prevent urinary tract infections. Tight clothing over the stoma obstructs blood circulation and urine flow. The nurse evaluates the effectiveness of the client's post-operative plan of care. Which of the following would be an expected outcome for a client with an ileal conduit? 1. The client verbalizes the understanding that physical activity must be curtailed. 2. The client will place an aspirin in the drainage pouch to help control odor. 3. The client demonstrates how to catheterize the stoma. 4. The client will empty the drainage pouch frequently throughout the day. The correct answer is 4. The client will empty the drainage pouch frequently throughout the day. It is important that the client empty the drainage pouch throughout the day to decrease the risk of leakage. The client does not normally need to curtail physical activity. Aspirin should never be placed in a pouch because aspirin can irritate or ulcerate the stoma. The client does not catheterize an ileal conduit stoma. A nurse is caring for a client with an ileal conduit. When assessing the stoma, which of the following outcomes are not desirable? Select all that apply. 1. Dermatitis. 2. Bleeding. 3. Fungal infection. 4. Use of adhesive solvent on the skin around the stoma. 5. Placing skin cement on the faceplate of the collection bag. The correct answers are 1. Dermatitis, 2. Bleeding, and 3. Fungal infection. Dermatitis with alkaline encrustations may occur when alkaline urine comes in contact with exposed skin. Yeast infections, or fungal infections, are another common peristomal skin problem. If the stoma is irritated from rubbing, there will be bleeding. The nurse and client should avoid irritating the stoma. Adhesive solvent should be used on a gauze pad to remove old adhesive and should, therefore, not contact the stoma directly. Only a minimal amount of skin cement is applied to the faceplate of the collection bag and skin to secure the appliance over the stoma, so obstruction of the stoma by the cement would not be possible if correct technique is followed. The nurse should teach the client with an ileal conduit to prevent urine leakage when changing the appliance by using which of the following procedures? 1. Insert a gauze wick into the stoma. 2. Close the opening temporarily with a cellophane seal. 3. Suction the stoma before changing the appliance. 4. Avoid oral fluids for several hours before changing the appliance. The correct answer is 1. Insert a gauze wick into the stoma. Inserting a gauze wick into the stoma helps prevent urine leakage when changing the appliance. The stoma should not be sealed or suctioned. Oral fluids do not need to be avoided. A nurse is planning care for a client who underwent a percutaneous needle biopsy of the kidney. What should the nurse plan to do immediately after the biopsy? Select all that apply. 1. Assess the biopsy site. 2. Take vital signs every hour. 3. Assess urine for hematuria. 4. Place the client in a prone position. 5. Assess the client for chest pain. The correct answers are 1. Assess the biopsy site. 3. Assess urine for hematuria. And 4. Place the client in a prone position. The nurse should assess the biopsy site for bleeding and hematoma formation. The client should remain prone for 8 to 24 hours after the biopsy. A pressure dressing will aid in blood coagulation. Vital signs assessment should be taken every 5 to 15 minutes for the first hour and then less often if the client is stable. The urine does not need to be collected and kept on ice. The nurse should collect serial urine specimens to assess for hematuria. A renal biopsy does not put the client at increased risk for chest pain. A client is admitted to the recovery room after cystoscopy with biopsy. Before the nurse can discharge the client, the nurse should be sure the client 1. Has a bowel movement. 2. Has received the first dose of pain medication. 3. Has voided. 4. Has no blood in the urine. The correct answer is 3. Has voided. The nurse should verify that the client has voided prior to discharge in order to evaluate bladder function. Bowel function is not expected to be affected by this procedure. There may not be a need for pain medication immediately post-procedure and before discharge, but the nurse should assess the client's pain status and inform the client about the use and side effects of the medication. It is normal for the client to have hematuria because of the procedure. The client with an ileal conduit will be using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? 1. Baking soda. 2. Soap. 3. Hydrogen peroxide. 4. Alcohol. The correct answer is 2. Soap. A reusable appliance should be routinely cleaned with soap and water. The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer. The nurse is evaluating the discharge teaching for a client who has an ileal conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. The correct answers are 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it, and 4. I must use a skin barrier to protect my skin from urine. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight of the urine from pulling the appliance away from the skin. A client is to have a cystoscopy. Which of the following indicate that the client has developed a complication after the cystoscopy? 1. Dizziness. 2. Chills. 3. Pink-tinged urine. 4. Bladder spasms. The correct answer is 2. Chills. Chills could indicate the onset of acute infection that can progress to septic shock. Dizziness would not be an anticipated symptom after a cystoscopy. Pink-tinged urine and bladder spasms are common after cystoscopy. A client has an ileal conduit. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleaned? 1. Salt water. 2. Vinegar. 3. Ammonia. 4. Bleach. The correct answer is 2. Vinegar. A distilled vinegar solution acts as a good deodorizing agent after an appliance has been cleaned well with soap and water. If the client prefers, a commercial deodorizer may be used. Salt solution does not deodorize. Ammonia and bleaching agents may damage the appliance. If the client develops lower abdominal pain after a cystoscopy, the nurse should instruct the client to do which of the following? 1. Apply an ice pack to the pubic area. 2. Massage the abdomen gently. 3. Ambulate as much as possible. 4. Sit in a tub of warm water. The correct answer is 4. Sit in a tub of warm water. Lower abdominal pain after a cystoscopy is frequently caused by bladder spasms. Warm water can help relax muscles. Ice is not effective in relieving spasms. Massage and ambulation may increase bladder irritability. A female client who has a urinary diversion tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm not normal. I don't see how I can go out in public anymore." The most appropriate nursing goal for this client is to 1. Manage her anxiety about her health. 2. Learn how to care for the urinary diversion. 3. Overcome feelings of worthlessness. 4. Express fears about the urinary diversion. The correct answer is 4. Express fears about the urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggesting that she discuss these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about this situation and may be feeling worthless, the underlying problem is a disturbance in body image. There are no data to indicate that the client does not know how to care for the urinary diversion. A client who has been diagnosed with bladder cancer is scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit 1. Is a temporary procedure that can be reversed later. 2. Diverts urine into the sigmoid colon, where it is expelled through the rectum. 3. Conveys urine from the ureters to a stoma opening on the abdomen. 4. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is 3. Conveys urine from the ureters to a stoma opening on the abdomen. An ileal conduit is a permanent urinary diversion in which a portion of the ileum is surgically resected and one end of the segment is closed. The ureters are surgically attached to this segment of the ileum, and the open end of the ileum is brought to the skin surface on the abdomen to form the stoma. The client must wear a pouch to collect the urine that continually flows through the conduit. The bladder is removed during the surgical procedure, and the ileal conduit is not reversible. Diversion of urine to the sigmoid colon is called a ureterosigmoidostomy. An opening in the bladder that allows urine to drain externally is called a cystostomy. The nurse teaches the client with urinary diversion to attach the appliance to a standard urine collection bag at night. The most important reason for doing this is to prevent 1. Urine reflux into the stoma. 2. Appliance separation. 3. Urine leakage. 4. The need to restrict fluids. The correct answer is 1. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent urine reflux into the stoma and ureters, which can result in infection. Use of a standard collection bag also keeps the appliance from separating from the skin and helps prevent urine leakage from an overly full bag, but the primary purpose is to prevent reflux of urine. A client with urinary diversion should drink 2,000 to 3,000 milliliters of fluid each day. It would be inappropriate to suggest decreasing fluid intake. After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? 1. Peritonitis. 2. Thrombophlebitis. 3. Hussitis. 4. Inguinal hernia. The correct answer is 2. Thrombophlebitis. After pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Hussitis is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision. The nurse is teaching the client with an ileal conduit how to prevent a urinary tract infection. Which of the following measures would be most effective? 1. Avoid people with respiratory tract infections. 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. 3. Use sterile technique to change the appliance. 4. Irrigate the stoma daily. The correct answer is 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. Maintaining a fluid intake of 2,000 to 3,000 milliliters per day is likely to be most effective in preventing urinary tract infection. A high fluid intake results in high urine output, which prevents urinary stasis and bacterial growth. Avoiding people with respiratory tract infections will not prevent urinary tract infections. Clean, not sterile, technique is used to change the appliance. An ileal conduit stoma is not irrigated. The nurse is assessing the urine of a client who has had an ileal conduit and notes that the urine is yellow with a moderate amount of mucus. Based on these data, the nurse should 1. Change the appliance bag. 2. Notify the physician. 3. Obtain a urine specimen for culture. 4. Encourage a high fluid intake. The correct answer is 4. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit. Because mucus in the urine is expected, it is not necessary to change the appliance bag or to notify the physician. The mucus is not an indication of an infection, so a urine culture is not necessary. A client is scheduled to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. Which of the following indicates that the client understands how to manage the urine as a biohazard? The client will 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. 3. Clean the bathroom daily with disinfectant wipes. 4. Use a separate bathroom from the rest of the family for the next 8 weeks. The correct answer is 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. After intravesical chemotherapy, the client must treat the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours following a treatment. It is not necessary to use a bedpan and then empty the urine in the toilet. The client can use the toilet, but must disinfect the urine with bleach. The bathroom does not need to be cleaned daily with disinfectant wipes. The client does not need to use a separate bathroom as long as the client's urine is disinfected with bleach. A female with uterine fibroids has dysmenorrhea and menorrhagia. After reviewing the laboratory reports, the nurse should report which results to the healthcare provider. Select all that apply. 1. Hemoglobin 9.0 grams per deciliter. 2. Hematocrit 27.1%. 3. White blood cell count 10,000 cells per cubic milliliter. 4. Potassium 4.0 milliequivalents per liter. 5. Normocytic red blood cells. The correct answers are 1. Hemoglobin 9.0 grams per deciliter and 2. Hematocrit 27.1%. A woman with uterine fibroids and dysmenorrhea is at risk for iron deficiency anemia. The hemoglobin and hematocrit indicate the likelihood that the fibroids causing heavy menstrual blood loss have resulted in anemia. A hemoglobin of less than 12 grams per deciliter in women is considered low. The white blood cell count and potassium levels are within normal parameters, and normocytic red blood cells are normal. A nurse is reviewing a client's chart and notes the Papa-Nicolau smear laboratory report indicates visualization of clue cells and a vaginal pH of 3.8. What should the nurse teach this client? Select all that apply. 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. 3. All vaginal infections are sexually transmitted infections. 4. Do not douche unless instructed by a healthcare provider. 5. Usually vaginal infections can be treated with over-the-counter preparations. The correct answers are 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. And 4. Do not douche unless instructed by a healthcare provider. Bacterial vaginosis is a clinical syndrome resulting from the replacement of the normal vaginal lactobacillus species with overgrowth of anaerobic bacteria that cause a cluster of symptoms. Presence of a thick, white, adherent vaginal discharge with a fishy odor is evidence for bacterial vaginosis, and the client should seek treatment. The client should not douche unless under medical prescriptions, because douching can cause bacteria to ascend into the uterus. Bacterial vaginosis is not sexually transmitted, and it does not require treatment of the partner. Vaginal infections commonly require an examination and diagnostic assessment. The client with an abdominal hysterectomy is being prepared for discharge in the morning. The client has a mentally retarded adult son whom she cares for at home. The nurse should discuss with the physician the need for referral to which of the following departments? 1. Home health care. 2. Social work. 3. Pastoral care. 4. Volunteer services. The correct answer is 2. Social work. The social worker will be able to coordinate respite care for the son and other community resources for this family. Home health care would provide care for the client herself, but respite care for the son is the priority need for this family. Pastoral care provides spiritual care. The volunteer department would not be responsible for coordination of care at the client's home. A nurse is discussing daily activities with a client. Which of the following activities puts the client at risk for altering the normal pH of her vagina? 1. Consuming over 4 cups of coffee per day. 2. Having sexual intercourse during the menstrual cycle. 3. Douching unless instructed to do so by the healthcare provider. 4. Using tampons during the menstrual cycle. The correct answer is 3. Douching unless instructed to do so by the healthcare provider. Douching may disrupt the normal flora of the vaginal lactobacilli and change the pH, which could result in overgrowth of other bacteria. Coffee, intercourse during menses, and tampons are not related to changes in vaginal pH or the incidence of bacterial vaginosis. The client will have an abdominal hysterectomy tomorrow. Which of the following information will be most important for the nurse to give to the client prior to admission to the hospital? 1. What to wear to the hospital. 2. What she can eat and drink before admission. 3. The type of pain medication that will be prescribed post-operatively. 4. The amount of activity she can have after surgery. The correct answer is 2. What she can eat and drink before admission. It is a priority that the client knows she will not be able to eat or drink for 8 hours before admission. A client who consumes food and fluid before receiving a general anesthetic is at risk for aspiration, which can lead to aspiration pneumonia, respiratory arrest, and even death. The clothing she should wear to the hospital and the type of medication she will receive are important, but not the priority. Information on exercise and resumption of normal activities can be included in the discharge teaching. Which should the nurse include when teaching a 55-year-old woman in the beginning of menopause? Select all that apply. 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. 3. Depression is very common as a result of menopause. 4. Hot flashes, especially at night, can occur in about 80% of women. 5. When periods become irregular, contraception is unnecessary. The correct answers are 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. And 4. Hot flashes, especially at night, can occur in about 80% of women. The average age of menopause is 50 to 52 years, although some variation exists. With menopause, follicle-stimulating hormone and luteinizing hormone levels increase dramatically. Hot flashes occur in about 80% of women. They can range from mild to very debilitating with disruption of sleep patterns. Depression is not usual during menopause. If symptoms of depression do occur, the nurse should refer the woman to her healthcare provider. Contraception should be used until menses has ceased for a full year. A client is prescribed oral metronidazole for treatment of bacterial vaginosis. What should the nurse instruct the client to avoid during treatment and for 24 hours thereafter? 1. Douching. 2. Sexual intercourse. 3. Hot tub baths. 4. Alcohol consumption. The correct answer is 4. Alcohol consumption. Metronidazole interacts with alcohol and can cause a serious disulfiram-type reaction with severe, prolonged vomiting. The client should not douche unless following a medical prescription, but douching does not interact with metronidazole. Sexual intercourse and hot tub baths are not known to affect the incidence or treatment of bacterial vaginosis. The nurse is witnessing the client's signature on the informed surgical consent for an abdominal hysterectomy. It is important to ascertain that the client understands that with this surgical procedure, she will have 1. Decreased libido. 2. Infertility. 3. Depression. 4. Weight gain. The correct answer is 2. Infertility. The client needs to understand that with removal of the uterus, she will no longer be able to bear children or have menstrual periods. The surgical procedure should not change her libido or sexual functioning. Research does not support the idea that hysterectomy contributes to depression or weight gain. Research demonstrates that women who have managed health problems for some time before the hysterectomy may actually have a more positive effect, with less worry about their health condition, contraception, or pregnancy. A nurse is assessing a client with vaginal discharge. Which of the following diseases are commonly associated with vaginal discharge? Select all that apply. 1. Candidiasis. 2. Bacterial vaginosis. 3. Gonorrhea. 4. Trichomoniasis. 5. Syphilis. The correct answers are 1. Candidiasis, 2. Bacterial vaginosis, and 4. Trichomoniasis. Candidiasis causes a white discharge that results in redness and itching. Bacterial vaginosis causes a thick, white, adherent discharge. Trichomoniasis causes a diffuse yellow-green discharge and is a sexually transmitted infection. Gonorrhea and syphilis usually do not change vaginal discharge. Which is the correct order, from first to last, for proper placement of a urinary catheter? 1. Lubricate the catheter adequately with a water-soluble lubricant. 2. Ensure free flow of urine. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. 4. Prepare a sterile field. The correct order is 4. Prepare a sterile field. 1. Lubricate the catheter adequately with a water-soluble lubricant. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. And 2. Ensure free flow of urine. After gathering appropriate supplies, the nurse should prepare a sterile field. After lubricating the catheter adequately with a water-soluble lubricant to minimize trauma to the urethra, the nurse should insert the catheter far enough into the bladder so the retention balloon does not traumatize urethral tissues. Ensuring a free flow of urine prevents infection. Improper drainage occurs when tubing is kinked or twisted. A female client with which condition would be at increased risk for vulvovaginal candidiasis? Select all that apply. 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. 3. Human immunodeficiency virus infection. 4. Hypertension. 5. Asthma. The correct answers are 1. Uncontrolled diabetes, 2. Immunosuppression due to cancer, and 3. Human immunodeficiency virus infection. Women with underlying medical conditions, such as uncontrolled diabetes and HIV infection or cancer-causing immunosuppression, correlate with an increasing severity of candidiasis. Hypertension and asthma are not related to immunosuppression or complicated candidiasis. Which of the following physical sensations will the client who has had an abdominal hysterectomy most likely experience if she hyperventilates while performing deep breathing exercises? 1. Dyspnea. 2. Dizziness. 3. Blurred vision. 4. Mental confusion. The correct answer is 2. Dizziness. Hyperventilation occurs when the client breathes so rapidly and deeply that she exhales excessive amounts of carbon dioxide. A characteristic symptom of hyperventilation is dizziness. To avoid hyperventilation, the nurse should assist the client in the practice of slow, deep breathing in a regular breathing pattern. Dyspnea, blurred vision, and mental confusion are not associated with hyperventilation. A client taking oral contraceptives is placed on a 10-day course of antibiotics for an infection. Which of the following instructions should the nurse include in the teaching plan? 1. Use a barrier method of birth control for the rest of your cycle. 2. You should stop taking the oral contraceptives while taking the antibiotic. 3. Call your healthcare provider for increased hunger or fluid retention. 4. Take the antibiotics 2 hours after the oral contraceptive. The correct answer is 1. Use a barrier method of birth control for the rest of your cycle. Antibiotics may decrease the effectiveness of oral contraceptives. The client should be instructed to continue the contraceptives and use a barrier method as a backup method of birth control until the next menstrual cycle. The client should not stop taking her oral contraceptives, and there is no indication for or benefit to taking the antibiotic 2 hours after the contraceptive. There is no incidence of the adverse effects of increased hunger and fluid retention with the interaction of antibiotic therapy and oral contraceptives. Which nursing measure would most likely relieve post-operative gas pains after abdominal hysterectomy? 1. Offering the client a hot beverage. 2. Providing extra warmth. 3. Applying a snugly fitting abdominal binder. 4. Helping the client walk. The correct answer is 4. Helping the client walk. The discomfort associated with gas pains is likely to be relieved when the client ambulates. The gas will be more easily expelled with exercise. The anesthesia, analgesics, and immobility have altered normal peristalsis. Peristalsis will be stimulated by exercise. Offering a hot beverage, providing extra warmth, and applying an abdominal binder are not recommended and could aggravate the discomfort of post-operative gas pains. A client is asking for information about using an intrauterine device. Which of the following questions asked by the nurse would provide pertinent information on whether or not a client is a candidate for an IUD? 1. Do you smoke? 2. Do you have hypertension? 3. How often do you have sex? 4. Are you in a monogamous relationship? The correct answer is 4. Are you in a monogamous relationship? Due to the increased risk of pelvic inflammatory disease, Candidates for the IUD should be in a monogamous relationship. Smoking and hypertension are not contraindications for an IUD. The frequency of sexual relations will not affect IUD use. On the second post-operative day after an abdominal hysterectomy, the client develops a temperature of 100.4 degrees Fahrenheit. The nurse's first action should be to 1. Increase the number of wound changes to minimize infection. 2. Obtain a culture and sensitivity study of the urine to determine the source of infection. 3. Ensure that the client takes at least 10 deep breaths every hour. 4. Change the site of the client's IV fluid catheter to reduce the risk of infection. The correct answer is 3. Ensure that the client takes at least 10 deep breaths every hour. Elevated temperature on the second post-operative day is suggestive of a respiratory tract infection. Respiratory infections most often occur during the first 48 hours after surgery. The client's vital signs should be monitored closely, and abnormalities should be reported to the surgeon. Signs of infection, if present in the wound or urinary tract, are likely to occur later in the post-operative period. There is no indication that the IV catheter is the source of infection. A nurse is caring for a hospitalized 22-year-old female client with type 1 diabetes mellitus and toxic shock syndrome. Which of the following should the nurse perform first? 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. 2. Administer 50 milligrams of meperidine IM every 4 hours as needed for pain. 3. Teach the client to use pads at night instead of tampons during her menstrual period. 4. Administer 400 milligrams of ciprofloxacin IV every 12 hours infused over 1 hour. The correct answer is 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. Fluid losses can occur from vomiting, diarrhea, and fever, and can lead to hypovolemic shock. The first nursing action is to treat the hypovolemic shock that accompanies toxic shock, so the IV fluids must be administered immediately. The fluid replacement is critical to avoid circulatory collapse. Pain medication and teaching can be implemented later. Antibiotics will be given because toxic shock syndrome is caused by a staphylococcal infection. However, fluid replacement is initiated first to treat life-threatening hypovolemic shock. The nurse is changing the dressing of a client after an abdominal hysterectomy. Which of the following nursing measures would be most appropriate if the dressing adheres to the client's incisional area? 1. Pull off the dressing quickly and then apply slight pressure over the area. 2. Lift an easily moved portion of the dressing and then remove it slowly. 3. Moisten the dressing with sterile normal saline solution and then remove it. 4. Remove part of the dressing and then remove the remainder gradually over a period of several minutes. The correct answer is 3. Moisten the dressing with sterile normal saline solution and then remove it. When a dressing sticks to a wound, it is best to moisten the dressing with sterile normal saline solution and then remove it carefully. Trying to remove a dry dressing is likely to irritate the skin and wound. This may contribute to tension or tearing along the suture line. A 39-year-old female client has been experiencing intermittent vaginal bleeding for several months. Her physician tells her that she has uterine fibroids and recommends an abdominal hysterectomy. When the client expresses fear about the surgery, the nurse should 1. Reassure the client of her physician's competence. 2. Give the client opportunities to express her fears. 3. Teach the client that fear impedes recovery. 4. Change the topic of conversation. The correct answer is 2. Give the client opportunities to express her fears. The best approach for a client who is fearful about having surgery is to allow the client opportunities to express her fears. Open-ended questions should elicit the client's individual and specific fears. This then gives the nurse the opportunity to provide clarification, information, and support, and possibly to offer other resources. The other actions are not supportive and deny the client the opportunity to express her feelings. When preparing discharge instructions for a client after an abdominal hysterectomy, the nurse should first 1. Have the client watch an educational video. 2. Assess the client's available social supports. 3. Call the social worker to evaluate the client. 4. Read the discharge instructions to the client. The correct answer is 2. Assess the client's available social supports. Assessment is the first step in planning client education. Assessing social support resources is a key aspect of discharge planning that begins when the client is admitted to the hospital. It is imperative to know what assistance and support the client has at home. Assessment includes obtaining data about any family or home responsibilities the client is concerned with during the recovery period. It is within the scope of nursing practice to provide discharge instructions. A social worker is not needed at this time. The nurse should assess the client's needs before determining whether using a video or reading instructions to the client is appropriate. Which of the following skin preparations would be best to apply around the client's colostomy? 1. Stomadhesive. 2. Petroleum jelly. 3. Cornstarch. 4. Antiseptic cream. The correct answer is 1. Stomadhesive. Stomadhesive is effective for protecting the skin around a colostomy to keep the skin healthy and prevent skin irritation from stoma drainage. Petroleum jelly, cornstarch, and antiseptic creams do not protect the skin adequately and may prevent an adequate seal between the skin and the colostomy bag. The nurse is assigning clients for the evening shift. Which of the following clients are appropriate for the nurse to assign to a licensed practical nurse to provide client care? Select all that apply. 1. A client with Crohn's disease who is receiving total parenteral nutrition. 2. A client who underwent inguinal hernia repair surgery 3 hours ago. 3. A client with an intestinal obstruction who needs a Cantor tube inserted. 4. A client with diverticulitis who needs teaching about take-home medications. 5. A client who is experiencing an exacerbation of his ulcerative colitis. The correct answers are 2. A client who underwent inguinal hernia repair surgery 3 hours ago, and 5. A client who is experiencing an exacerbation of his ulcerative colitis. The nurse should consider client needs and scope of practice when assigning staff to provide care. The client who is recovering from inguinal hernia repair surgery and the client who is experiencing an exacerbation of ulcerative colitis are appropriate clients to assign to a licensed practical nurse, as the care they require falls within the scope of practice for a licensed practical nurse. It is not within the scope of practice for the licensed practical nurse to administer TPN, insert nasoenteric tubes, or provide client teaching related to medications. Which of the following guidelines reflects the current American and Canadian Cancer Society's recommendations for screening for colon cancer in individuals who are not at high risk? 1. Annual digital rectal examination should begin at age 40. 2. Annual fecal testing for occult blood should begin at age 50. 3. Individuals should obtain a baseline barium enema at age 40. 4. Individuals should obtain a baseline colonoscopy at age 45. The correct answer is 2. Annual fecal testing for occult blood should begin at age 50. Annual fecal testing for occult blood should begin at age 50. Annual digital rectal examinations are recommended in men beginning at age 50 to screen for prostate cancer. Baseline barium enemas or colonoscopies are recommended at age 50. Baseline barium enemas and colonoscopies are not performed on individuals in their 40s unless they experience signs or symptoms that indicate the need for such diagnostic testing or are considered to be at high risk. A client has been placed on long-term sulfasalazine therapy for treatment of ulcerative colitis. The nurse should encourage the client to eat which of the following foods to help avoid the nutrient deficiencies that may develop as a result of this medication. 1. Citrus fruits. 2. Green leafy vegetables. 3. Eggs. 4. Milk products. The correct answer is 2. Green leafy vegetables. In long-term sulfasalazine therapy, the client may develop folic acid deficiency. The client can take folic acid supplements, but the nurse should also encourage the client to increase the intake of folic acid in his diet. Green leafy vegetables are a good source of folic acid. Citrus fruits, eggs, and milk products are not good sources of folic acid. A client refuses to look at or care for her colostomy. Which of the following statements by the nurse would be most appropriate? 1. It has been 4 days since your surgery, and you will soon be discharged. You have to learn to care for your colostomy before you leave the hospital. 2. I think we will need to teach your husband to care for your colostomy if you are not going to be able to do it. 3. I understand how you are feeling. It is important for you to feel attractive, and you think having a colostomy changes your attractiveness. 4. I can see that you are upset. Would you like to share your concerns with me? The correct answer is 4. I can see that you are upset. Would you like to share your concerns with me? It is important for the nurse to recognize that individuals go through a grieving process when adjusting to a colostomy. The nurse should be accepting and provide the client with opportunities to share her concerns and feelings when she is ready. Lecturing the client about the need to learn how to care for the colostomy is not productive, nor is attempting to shame her into caring for the colostomy by implying her husband will have to provide the care if she does not. It is not possible for the nurse to understand what the client is feeling. The nurse teaches the client who has had rectal surgery the proper timing for sitz baths. The client has understood the teaching when the client states that it is most important to take a sitz bath. 1. First thing each morning. 2. As needed for discomfort. 3. After a bowel movement. 4. At bedtime. The correct answer is 3. After a bowel movement. Adequate cleaning of the anal area is difficult but essential. After rectal surgery, sitz baths assist in this process, so the client should take a sitz bath after a bowel movement. Other times are dictated by client comfort. Which of the following is a potential risk factor for the development of colon cancer? 1. Chronic constipation. 2. Long-term use of laxatives. 3. History of smoking. 4. History of inflammatory bowel disease. The correct answer is 4. History of inflammatory bowel disease. A history of inflammatory bowel disease is a risk factor for colon cancer. Other risk factors include age, history of familial polyposis, colorectal polyps, and high-fat or low-fiber diet. The nurse instructs the client who has had a hemorrhoidectomy not to use sitz baths until at least 12 hours post-operatively to avoid inducing which of the following complications? 1. Hemorrhage. 2. Rectal spasm. 3. Urine retention. 4. Constipation. The correct answer is 1. Hemorrhage. Applying heat during the immediate post-operative period may cause hemorrhage at the surgical site. Moist heat may relieve rectal spasms after bowel movements. Urine retention caused by reflex spasm may also be relieved by moist heat. Increasing fiber and fluid in the diet can help prevent constipation. The nurse is conducting a community presentation on the early detection of colon cancer. Which of the following should the nurse encourage members of the audience to report to their healthcare providers? Select all that apply. 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. 5. Positive fecal occult blood testing. The correct answers are 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. And 5. Positive fecal occult blood testing. Colorectal cancer may be asymptomatic, or symptoms vary according to the location of the tumor and the extent of involvement. Fatigue, weight loss, and iron deficiency anemia, even without rectal bleeding or bowel changes, should prompt investigation for colorectal cancer. Fecal occult blood testing commonly reveals evidence of carcinoma when the client is otherwise asymptomatic. Which position would be best for the client in the early post-operative period after a hemorrhoidectomy? 1. High Fowlers. 2. Supine. 3. Side-lying. 4. Trendelenburgs. The correct answer is 3. Side-lying. Positioning in the early post-operative phase should avoid stress and pressure on the operative site. The prone and side-lying positions are ideal from a comfort perspective. A high Fowler's or supine position will place pressure on the operative site and is not recommended. There is no need for Trendelenburg's position. A client with colon cancer is having a barium enema. The nurse should instruct the client to take which of the following after the procedure is completed? 1. Laxative. 2. Anticholinergic. 3. Antacid. 4. Demulcent. The correct answer is 1. Laxative. After a barium enema, a laxative is ordinarily prescribed. This is done to promote elimination of the barium. Retained barium predisposes the client to constipation and fecal impaction. Anticholinergic drugs decrease gastrointestinal motility. Antacids decrease gastric acid secretion. Demulcents soothe mucous membranes of the gastrointestinal tract and are used to treat diarrhea. A 36-year-old female client has been diagnosed with hemorrhoids. Which of the following factors in the client's history would most likely be a primary cause of her hemorrhoids? 1. Her age. 2. 3 vaginal delivery pregnancies. 3. Her job as a schoolteacher. 4. Varicosities in her legs. The correct answer is 2. 3 vaginal delivery pregnancies. Hemorrhoids are associated with prolonged sitting or standing, portal hypertension, chronic constipation, and prolonged increased intra-abdominal pressure as associated with pregnancy and the strain of vaginal delivery. Her job as a schoolteacher does not require prolonged sitting or standing. Age and leg varicosities are not related to the development of hemorrhoids. A client has a nasogastric tube inserted at the time of abdominal perineal resection with permanent colostomy for colon cancer. This tube will most likely be removed when the client demonstrates 1. Absence of nausea and vomiting. 2. Passage of mucus from the rectum. 3. Passage of flatus and feces from the colostomy. 4. Absence of stomach drainage for 24 hours. The correct answer is 3. Passage of flatus and feces from the colostomy. A sign indicating that a client's colostomy is open and ready to function is passage of feces and flatus. When this occurs, gastric suction is ordinarily discontinued, and the client is allowed to start taking fluids and food orally. Absence of bowel sounds would indicate that the tube should remain in place because peristalsis has not yet returned. A client with colon cancer has developed ascites. The nurse should conduct a focused assessment for which of the following. Select all that apply. 1. Respiratory distress. 2. Bleeding. 3. Fluid and electrolyte imbalance. 4. Weight gain. 5. Infection. The correct answers are 1. Respiratory distress and 3. Fluid and electrolyte imbalance. Ascites limits the movement of the diaphragm, leading to respiratory distress. Fluid shift from the intravascular space precipitates fluid and electrolyte imbalances. Weight gain is not a direct consequence of ascites, but weight loss may result in decreased albumin levels. Decreased albumin in the intravascular space results in decreased oncotic pressure, precipitating movement of fluid out of space. A client with ascites is not at increased risk for infection unless a peritoneal tap is done to remove fluid. The risk of bleeding is a result of alterations in liver enzymes affecting coagulation. A client is recovering from an abdominal perineal resection. Which of the following measures would most effectively promote wound healing after the perineal drains have been removed? 1. Taking sitz baths. 2. Taking daily showers. 3. Applying warm, moist dressings to the area. 4. Applying a protected heating pad to the area. The correct answer is 1. Taking sitz baths. Sitz baths are an effective way to clean the operative area after an abdominal perineal resection. Sitz baths bring warmth to the area, improve circulation, and promote healing and cleanliness. Most clients find them comfortable and relaxing. Between sitz baths, the area should be kept clean and dry. A shower will not adequately clean the perineal area. Moist dressings may promote wound contamination and delay healing. A heating pad applied to the area for longer than 20 minutes may cause excessive vasodilation, leading to congestion and discomfort. The client with colon cancer has an abdominal perineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-operative period? 1. Maintain the client in a semi-Fowler's position. 2. Assist the client with warm sitz baths. 3. Administer 30 milliliters of milk of magnesia to stimulate peristalsis. 4. Remove the ostomy pouch as needed so the stoma can be assessed. The correct answer is 2. Assist the client with warm sitz baths. Appropriate nursing interventions after an abdominal perineal resection with a colostomy include assisting the client with warm sitz baths 3 to 4 times a day to clean the perineal incision. The client will be more comfortable assuming a side-lying position because of the perineal incision. It would be inappropriate to administer milk of magnesia to stimulate colostomy activity. Stool passage will begin as peristalsis returns. It is not necessary or desirable to change the ostomy pouch daily to assess the stoma. The ostomy pouch should be transparent to allow easy observation of the stoma and drainage. Which of the following is an expected outcome for a client who is recovering from an abdominal perineal resection with a colostomy? The client will 1. Maintain a fluid intake of 3,000 milliliters per day. 2. Eliminate fiber from the diet. 3. Limit physical activity to light exercise. 4. Accept that sexual activity will be diminished. The correct answer is 1. Maintain a fluid intake of 3,000 milliliters per day. An expected outcome is that the client will maintain a fluid intake of 3,000 milliliters per day, unless contraindicated. There is no need to eliminate fiber from the diet. The client can eat whatever foods are desired, avoiding those that are bothersome. Physical activity does not need to be limited to light exercise. The client can resume normal activities as tolerated, usually within 6 to 8 weeks. The client's sexual activity may be affected, but it does not need to be diminished. The nurse assesses the client's stoma during the initial post-operative period. Which of the following observations should be reported immediately to the physician? 1. The stoma is slightly edematous. 2. The stoma is dark red to purple. 3. The stoma oozes a small amount of blood. 4. The stoma does not expel stool. The correct answer is 2. The stoma is dark red to purple. A dark red to purple stoma indicates inadequate blood supply. Mild edema and slight oozing of blood are normal in the early post-operative period. The colostomy would typically not begin functioning until 2 to 4 days after surgery. When planning diet teaching for the client with a colostomy, the nurse should develop a plan that emphasizes which of the following dietary instructions. 1. Foods containing roughage should not be eaten. 2. Liquids are best limited to prevent diarrhea. 3. Clients should experiment to find the diet that is best for them. 4. A high-fiber diet will produce a regular passage of stool. The correct answer is 3. Clients should experiment to find the diet that is best for them. It is best to adjust the diet of a client with a colostomy in a manner that suits the client rather than trying special diets. Severe restriction of roughage is not recommended. The client is encouraged to drink 2 to 3 liters of fluid per day. A high-fiber diet may produce loose stools. While changing the client's colostomy bag and dressing, the nurse assesses that the client is ready to participate in self-care by noting which of the following. 1. The client asks what time the doctor will visit that day. 2. The client asks about the supplies used during the dressing change. 3. The client talks about the news on the television. 4. The client is upset about the way the night nurse changed the dressing. The correct answer is 2. The client asks about the supplies used during the dressing change. A client who displays interest in the procedure and asks about supplies used for dressings may be ready to participate in self-care. Inquiring about the physician's visit, discussing news events, and discussing a dressing change are behaviors that avoid the subject of the colostomy.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.